Okay, so I'm going to begin this lecture recording for Module 1 with a little discussion over chapters 2 and 4 in your Ward and Heisley textbook. Okay, so on this first slide here, we're going to talk a little bit about health promotion. Health promotion happens to be something that's very near and dear to my heart. I believe that we can help our clients the most by educating them about how to live a healthier lifestyle. And it's more than just telling them what kind of foods to eat or what kind of exercise or things like that. It's more changing the way they live and trying to find ways to help them want to live healthier lives. That's the way to make real lasting change. So there's a couple of different health promotion activities here that I'm going to go over. I'm going to start with the intervention wheel, and that is on page 31 of your textbook. This might not be one that you are very familiar with. It's a public health intervention model. This model goes through 3 levels of intervention. It's targeted at individuals, families, communities, and also societal systems. So if you get time, please take some time to review that and take a look at it. There's a pictorial example of it on page 31 up at the top, figure 2-1. The next initiative I wanted to kind of go over is Healthy People 2020. Now this may be one that you are more familiar with. This one has been around since 1979. It gets updated every 10 years. It defines healthcare priorities. It guides progress toward the ultimate goal of optimal health. And one of the 4 overarching goals of this initiative is to promote longer, healthy lives free of preventable disease. So please take some time to go on the website. It's a really user-friendly website. I feel that this kind of information is important for healthcare providers to have, because especially when we're working with families, we want to be able to encourage and educate our families about quality resource information where they can go and get good ideas of how to be healthier, what are good nutritious snacks and foods that they could eat, what kind of exercise would be good for them. And this kind of website has all of that information. There's lots of embedded videos, and as I said, it's very user-friendly. Okay, so since we're talking health promotion, let's talk a little bit about prevention. So there are 3 levels to prevention. There is primary prevention, which this is more geared toward health promotion, healthy diet, exercise, things like getting flu shots and immunizations. Secondary prevention is more geared toward early identification. So screenings such as mammograms or colonoscopies, pap smears. Tertiary prevention is where we want to restore health. We want to provide treatment. We want to try to get our clients back to an optimal level of functioning. Now, in this case, this is someone who has a chronic health condition, something such as COPD or chronic obstructive pulmonary disease. So we would take care of them and help to restore their health through medications, through diet, and also through things like pulmonary rehab or cardiac rehab. As we go through our discussion today, we definitely want to remember that prevention is the best way. Our medicine today is more geared toward prevention. We want to stop the disease before it ever occurs, and in those cases we're using primary prevention, or we want to identify it early and try to ameliorate the potential complications that could occur. So that's where secondary prevention comes in. Or if the patient has the complications and the disease process already, we want to try to restore them to their optimal level of functioning. Okay, so when working with women and families. So families are the core unit where health habits are first formed. This is where we learn about how to eat, we learn what to eat, we start developing our eating habits through our family. We also have access to health insurance, okay, through our parents. And then again, we're talking Healthy People 2020, which One of the initiatives of Healthy People 2020 is to try to increase access to health insurance to 100%. That's a pretty auspicious goal, but that is one of their goals. As far as women are concerned, we are seeing an increase in heart disease in our female population, especially in our females that are postmenopausal. And also perinatal health. We are trying to advocate and educate our female population about perinatal health. It's very important that in order to have healthy babies, that we have healthy mommies. So we're trying to really work hard to educate our childbearing age women about making sure that they are getting adequate prenatal care. Okay, a little bit about healthcare today. So current healthcare delivery, the system that we currently have, it's a very complex system. It's a collection of entities. It's more run like a business. So definitely the insurance companies are the driving force of our healthcare delivery system today. It's very corporate and very market driven. The quality of healthcare and the consumer satisfaction are what drives our healthcare today. So when they do those patient satisfaction surveys, that's very, very important to that healthcare delivery system because you have a choice. You can choose which health facility you receive care from. So, and with all of our social media today and all the ways that we communicate with each other, once the word gets out, we definitely want it to be a positive word because they don't need to choose us for their care if we're not doing the best that we possibly can. But on the flip side of that, we also want to be delivering quality care. We want to make sure that we are achieving the best patient outcomes that we possibly can through the care that we give. So it can be a very fine line. It can be very difficult choosing between providing real quality health care, making sure that we're having really good outcomes, as well as making sure that we have satisfied customers. So that's a lot of work and that's not easy to achieve. Okay, so there's just a few public policies and programs that I just wanted to draw your attention to. If you look on page 39 of your textbook, it does go through these programs. So Women, Infants, and Children, or WIC, this is a program that I'm sure you're probably familiar with. So with this program here, it targets pregnant women, infants, and children that are of the age 5 and younger. So what this program does is it provides nutritious foods and nutrition counseling and education to these women and their children. It serves the low-income families and any pregnant woman who has a particular nutritional challenge. Okay, they have such as like diabetes or anemia. It's a great program. And definitely one that if you're going to work with women or children or families, it's definitely one that you're going to want to be familiar with. Medicaid, I'm sure we're all very, very familiar with. This was a legislation that was part of the Title 15 of the Social Security Act. It's a major publicly funded program. So this one pays for a lot of health care for low-income families. Okay, so this is where at least they can have some access. It doesn't pay for everything, but it does pay for a certain percentage. Although sometimes the healthcare systems do have trouble getting reimbursement for the services that are provided, and that can be an issue for some healthcare providers. But the majority of healthcare providers do accept Medicaid. The Newborn and Mothers Health Protection Act, you may not be familiar with this. This came into effect in 1996. So with this Protection Act, previously women who had no complications with their delivery, say they had a vaginal delivery, they would have to be discharged within 24 hours. Their insurance would not pay for them to be in the hospital any longer. Or if they had a section, a cesarean section with no complications, they would only be allowed to stay in for maybe 48 hours. and then they would have to be discharged. So this Protection Act has been established because they were noting that there was a lot of complications that were happening to these women after they went home. Okay, so now a vaginal delivery that doesn't have any complications can stay for 48 hours at a minimum, and a cesarean section delivery that has no complications can stay for up to 96 hours. So this is a law that's been enacted, and the insurance companies have to go along with it. So I think that's wonderful, because I was noticing in my practice a lot of women were coming back in to the emergency room with maybe a hemorrhage or maybe high blood pressure from preeclampsia. So there was a lot of complications that were happening because the women were going home, and we really weren't able to provide them the education that they needed to make sure that these complications didn't occur. The Family and Medical Leave Act, FMLA, you may or may not be familiar with that, but I think that's another really good policy that is in place. It's a law that permits American workers to take up to 12 weeks of unpaid leave per year without losing their job. And this could be for a family illness. This could be for a personal illness. Anyone who is working is allowed to, you have to fill out paperwork, but you are allowed to utilize FMLA and not worry that you're going to lose your job. And then the Affordable Care Act, probably most commonly known as Obamacare, even though that's not what it is, but that is how people refer to it. But this was really to be able to provide access to health care to those that don't have health insurance. But unfortunately, it still doesn't provide enough insurance. Or maybe the insurance is still too expensive for the person that has a lower income to afford. But at least they have the availability to access it. So it has helped to have access to those that didn't have access before, because now you have to have insurance really to get any kind of medical care other than the emergency room. You have to have insurance. So the Affordable Care Act really has done a lot to help to ameliorate some of that problem. Okay, so now we're going to talk about some delivery systems. And a lot of this information you may already be familiar with, but in women and children, they are a vulnerable population, and in some cases, they do not have access to health care for many reasons. There's lots of barriers to them having access. So some of this that I'm going to talk about are ways that we can provide health care for them and provide that access to them. So telemedicine is a wonderful thing that we can utilize to provide health care to those that don't have access. Maybe they live in a remote rural location and aren't able to access their health care, or they are very low socioeconomic status and can't afford to access. But telemedicine is one avenue that could be utilized, where you could meet with a healthcare provider virtually, or you can phone and do triage that way. You can give them what's been going on, and they'll tell you whether or not you need to go to the emergency room or not. The remote access to healthcare providers, that's definitely something new on scene, where you can use a webcam to meet with your provider without actually having to ever leave your home. You can send digital photos to specialists, saving money not having to travel. You can just send them digital photos and they'll take a look at them, and then they'll get back in touch with you and let you know if there's anything that you need to do. Again, webcams are used to assess patients with disabilities or who live in those remote areas. The doctor can take a look at them and discuss with them what their symptoms are and what's happening with them. Telemedicine technology can be used for access to medical interpreters, which I think is great, because we have a large proportion of our population that does not speak English. So being able to access an interpreter through the telemedicine is definitely a wonderful thing. And then, of course, there's home surveillance of the elderly population. Some home care programs do have surveillance for their clients that have chronic diseases like congestive heart failure. They can wear devices on them either through a watch or maybe something that they wear around their neck, which will be able to monitor their vital signs. They can send their blood pressures in every day. They can weigh themselves and they can send that to the home care company every day. So this way, they are kind of keeping tabs on how that person is doing, and if they're noticing a trend, they're going to get in touch with them and let them know that maybe they need to come in and be seen. So this is some of the newer technology that's out that we definitely want to be aware of, especially when we're dealing with families, women, or children. Okay, so now we're going to talk chapter 4, which is caring for women, children, and family. All right, health assessment and promotion. So health promotion is definitely key when you are working with families. So health screenings, health promotion screenings, and anticipatory guidance. Anticipatory guidance is definitely a term you're going to hear me use a lot because I definitely think that that is the best way to educate. Let them know what to expect, and then when it happens, they're not shocked, or they have some understanding and they can prepare themselves for what's going to happen. So definitely, to me, the best way to educate our clients is to provide them with anticipatory guidance so they can anticipate what's ahead. Health screening schedules, things such as immunizations or pap smears, mammograms, colonoscopies, all those types of things that we do to try to promote better health or to catch things early. Health promotion screening, so maybe looking at their diet, maybe looking at their activity levels, taking a look at their family health, doing a complete health history and finding out if they have any genetic type of diseases maybe that we should be aware of and that they should be aware of, that these could be an issue for them at some point, and maybe try to educate them a little bit about those disease processes and what to look for so that they are aware. This whole slide here is all talking about promoting awareness. That's what all of this information is about. We want to make sure that our families are prepared and aware. Okay, infant and child health. So nutritional guidance. When we're talking infant feedings, we are talking about either breastfeeding or formula feeding. So obviously we know that breast is best, right? Because that is what our bodies are engineered to be able to tolerate. It's a very rare case that a baby is going to have any type of allergy to breast milk. It's very rare that they're going to have any GI issues with breast milk where they're not tolerating it. But breastfeeding, as we're going to learn as we go through this quarter, is not easy to do. It's definitely something where you have to teach the mom how to breastfeed. There's a right way and there's a wrong way. So that may not always be the optimal choice, especially when you're talking about a working mom who maybe doesn't have the time to devote to breastfeeding, because you'll also have to have time to breastfeed. The other option is formula feeding, and there isn't anything wrong with formula feeding, but there's a lot of entities out there that would definitely advocate for breastfeeding. Breast is best, it's the most natural, and you might hear a lot of things like that as we go through this quarter. But I don't find anything wrong with formula feeding. As far as children are concerned, it's very important that they are getting good nutrition because they're growing. They do a lot of growing throughout their childhood, and they definitely need a good nutrition to be able to do that growing, right? To be able to have good, strong bones and healthy skin, and making sure that we're promoting good, healthy organs on the inside that They have plenty of energy because kids are pretty active and we want to make sure that we're providing enough energy for them. Dental care is essential. Now, this can get a little bit of a problem when we're talking lower socioeconomic families because dental care is very expensive and not everybody has insurance for dental care. But there are options. There are a lot of clinics out there that will provide dental care to lower socioeconomic families at either no cost or very, very, very low cost. But dental care is very important because if they were to get an infection within their mouth, that infection could turn septic very quickly. And if that happens, then we're going to maybe have a bad outcome. And that can happen to kids just as easily as it can happen to adults. And definitely promoting sleep and rest. Infants and children definitely need sleep and rest. That's where our body is regenerating. That's where we do a lot of our growing. That's where we do a lot of our healing. So we definitely want to be able to promote sleep and rest and to educate our parents about the importance of sleep and rest, making sure that they're establishing a schedule with their kids of when is bedtime, making sure that we're not letting them try to stay up too late into the night, but making sure that they're getting on a pretty regular schedule. It's very important. And actually, kids like having a schedule. When their schedule's messed up, they get very upset. Okay, so continuing on with infants and children. So safety, definitely very important. And along with that is injury prevention, especially with your young infant that is transitioning to toddler, because once those legs get to working, they get into everything. Once they're mobile, that's when we really want to advocate about things being safe, cabinets being locked, gates being put up so that they don't get into rooms that they shouldn't be in, making sure that medications are put away safely, making sure cleaning supplies are put away. Injury prevention also, because remember, toddlers, they have very large heads and they are very unsteady on their feet because of that, and that causes them to fall a lot. Risk-taking behaviors. So for kids, yeah, they definitely can take risks, especially as they're getting into that school age. Definitely risk-taking behaviors. Maybe goofing around with their friends, trying to seem like they're not afraid to do certain things. They start playing with fire. School-age kids definitely have a fascination with fire. They like to test limits, and that's true of kids of any age. They want to know how far they can take it. They want those rules, though. Most parents don't realize that kids really do want the rules. They want structure, okay? But they will test those limits. Play is very important. It gets underscored a lot, but play is how kids kind of express their feelings. Play is also how they learn how to socialize with one another and what's appropriate behavior and what's not appropriate. Immunizations, we're going to talk a lot about immunizations as we get further along into the pediatric part of the quarter. And then figure 4-2 for the CDC recommendation. So there is a recommended immunization schedule in the textbook, and I think it's a really good one. So make sure that you refer to that and keep that in the back of your mind. Write that down because you're definitely going to want to have that information when we get into the pediatric section. Okay, so for our adolescents, nutrition, obesity. Okay, so obesity has become a public health crisis, and it affects children every bit as much as it affects adults. But for our adolescent population, it may have more psychological implications because kids don't, adolescents, they don't want to be different. Their peers are very, very important to them, and what their peers think of them is very, very important. Then there's medical factors. With obesity and with the rise of obesity, we are now having children being diagnosed with type 2 diabetes, whereas before we never had that, but we have that now. It used to be considered adult onset, but now kids are being diagnosed with it. The other problem with adolescents is the eating disorders. Things like anorexia and bulimia. They definitely strike during that adolescent stage. Again, dental care, very important. As I said previously, dental care is very important for children of all ages. And then sleep and rest. Now, this might be difficult because your adolescents, a lot of times, they like to stay up till all hours. They're afraid they're going to miss something. Maybe somebody's going to post something on their Facebook, or someone's going to tweet something at them, or somebody's going to send them a text message or whatever. And if they go to sleep, they'll miss it. But it's very important that we educate our families about the fact that these kids do need their sleep, because again, this is where our bodies are regenerating. This is where our bodies are healing, and our brains definitely need that time to wire down and relax in order to function properly when we're awake. Okay, so for young adults, I've put up here the My Plate. So My Plate pretty much has taken the place of the food pyramid. Okay, and I think it's a wonderful visual representation. I think that it's a great education tool that you can utilize for either kids or adults. For safety with our young adults, substance abuse definitely would be something that we would need to be aware of with our young adult, and also sexual health. Now, a young adult would be considered someone who's maybe college age, getting into like your 20s, late 20s. That would be considered young adult, 30s. So definitely wanting to be educating them about safe sex practices. For health promotion, things like testicular cancer screenings, making sure that they're doing testicular self-exams. Also breast self-exams. I don't have that on this slide, but definitely breast self-exams are going to be important for our females. Some gynecological disorders that you may come across with the young adults, endometriosis, and also cervical cancer. Now, cervical cancer is one of those silent cancers that unfortunately we aren't aware of until it's too late. It doesn't have any signs or symptoms attached to it until it's way far along to maybe stage 4 or stage 5. So it's very important to be educating our young females about getting those pap smears done. And then urinary tract infections. And this would be more for our female population, but males also get urinary tract infections. So making sure that we're very good with our perineal care, making sure that for females that they don't take too many baths, because that's definitely going to be a risk for urinary tract infections. And if they're having any of the symptoms, again, providing that anticipatory guidance to seek that medical care before it gets too far out of hand. We definitely want to catch it early, and that way we can take care of it more quickly. So middle adulthood, this would be in your 40s or your 50s. So some health promotion and screenings for our middle adult: breast health, breast cancer screenings, things like mammograms, colorectal cancer screening, things like colonoscopies. So the current recommendations are 50 years of age. Cholesterol and lipid screenings, that's pretty standard. That would be done at a yearly health exam that you go and see your provider for. Uh, the climacteric, this might be something that you're not familiar with, but this goes along with our female population. So climacteric, it's the transitional time in a woman's life where we're having declining ovarian function and decreased hormone production. This begins at the onset of ovarian decline and ends with the cessation of postmenopausal symptoms. So it takes quite a lot of time. Perimenopausal is the time before a woman will go through menopause. There's no real set time of how long that takes, but that usually starts before she actually goes through menopause. She may have some of those symptoms, maybe start having some mild behavioral changes, maybe some of those hormonal influences that she'll go through as she goes through menopause. Menopause, that's obviously where her last menstrual period happens, and can be dated with certainty only 1 year after the menstruation ceases, according to your textbook. Average age, 51 years. So, but it could happen at any time between the ages of 35 and 60. And 35 is pretty young. That's probably the rarer age. Usually happens in the 50s. Could take 10 years to get through menopause. That's pretty average. And then there's, of course, the postmenopause. Postmenopause, obviously, after you're not having those hormones any longer, you're not having your period any longer. The estrogen is produced solely by the adrenal glands now. It's no longer being produced by the ovaries. While there's no specific treatment, I mean, there's things that women can take. There's some natural remedies out there that they can take. There's also prescription things that they can take for things like hot flashes, uh, you know, some of those behavioral type of symptoms that they may get where they get really irritable or maybe they get kind of short-tempered. But for the most part, it's a natural part of life. And again, we want to provide that anticipatory guidance. And it's not something that, nobody knows about. I think menopause, postmenopause, that's pretty well known. I think that with our society now, that definitely, that information is out there. So, but again, providing that anticipatory guidance for our older or our middle adult clients, just to making sure if they have any questions or concerns, if they, are having any symptoms that they aren't comfortable with, to make sure that they're letting either us know or so that we can let their provider know and maybe make arrangements for them if they need some sort of a supplement or some sort of medication. Common health problems in women, osteoporosis. This can occur also in men, but it's more common in women. Pelvic floor dysfunction, so some issues that you may see, either bladder prolapse or uterine prolapse, and also endometrial cancer. That is something that definitely can happen at this age. Prostate cancer screening in men, and mental and emotional health. We want to make sure that we are providing them anticipatory guidance about that, making sure that we're providing support and encouraging a safe environment, that there's no judgment there. We want to encourage them to talk about these issues with us. Mental health and emotional health are issues that not a lot of people choose to talk about because there's a lot of stigma attached to them and it makes them very uncomfortable. But we definitely want to convey an attitude of acceptance and that we are not going to judge them, that we just want to help them, and we want to make sure that we connect them with whatever resources that they may need. And sometimes just talking about it to somebody who seems like they care helps that person to feel so much better. So that's all for this recording. So if you have any questions, please let me know. Thank you.